Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, heart diseases is difficult enough when it strikes adults, but it can be especially tragic in children. Many different types of heart problems can affect children. They include congenital heart defects, viral infections that affect the heart, even heart diseases acquired later in childhood due to illnesses or genetic syndromes. But the good news is that with advances in medicine and technology, many children with heart diseases go on to live active, full lives. Well, to discuss on this, we have with us in studio Dr. Supriya Choudhary, Pediatric Cardiologist from Health City Hospital. So not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Well, thank you so much, Dr. Supriya, for coming to Good Life, the health show. So I'm sure in the entire episode, we will be able to do the justice on the topic which we have taken today, that is congenital heart diseases, which is heard, and in fact, it is a scientific term. So I'm sure the viewers must be thinking what exactly it is. So first, let's put some light on what exactly congenital heart disease is.
Thanks, Pooja. So when we talk about heart diseases in children, it is usually of two types. First, the children may be born with heart diseases, that is the diseases which are present since birth. These are known as congenital heart diseases.
Okay.
And if the children acquire it later in life, then they are known as acquired heart diseases.
Okay.
And in children, most of the diseases, around 80%, are congenital heart diseases. Acquired heart diseases are very few in number in
Very
children.
few.
Yeah.
Okay.
So congenital heart diseases, that is the diseases which are present since birth, they may manifest later in life. They may not manifest right from the beginning of the child's life, but they are definitely present since birth. So these are called congenital heart diseases.
So that is seen by birth. So how common are they, like in your practice or in your cases when you find out? So how common are they?
Children can have many birth defects, like we see cleft lip, cleft palate, defects in various organs. If we take all of them into account, the congenital heart defects are one of the most common among all the congenital defects.
Okay.
So if I have to give you some numbers, then if 1,000 children are born, 8 or 10 out of them will have some defect in the heart.
Okay.
It may be a minor one or a major one, but 8 or 10 out of 1,000 childbirth will have some form of heart defect. So if we look at the population of India and the childbirth, in India we get around 2.8 crore children are born every year, and out of them 1.8 lakhs they are born with congenital heart diseases. So you can see it's a huge number. And out of these children, around 25%, they are born with critical heart diseases.
Critical heart disease.
Critical, when I say critical, I mean to say that the diseases are so complex that if they are not treated within maybe first few days or month, or at least by first 1 year of life, we will lose the child.
Okay.
And rest of the 75% of the diseases, sometimes they do not manifest till about end of the year, or maybe up to 2 to 3 years of age, and they can be tackled more easily because they give us some time for diagnosis, and we can electively decide when to treat them.
Okay.
So this is the scenario.
So there is a time period like when to treat them, and depending on the causes and also on the vulnerability, because is there any specific cause why some children have that, and why is it found in some children? So what is the specific cause seen in these children?
See, whenever we diagnose a child with congenital heart disease, the first reaction of the patient is anxiety and panic.
Absolutely.
And they have a single question in mind: did we do something wrong due to which our child has this problem? So I would like to tell them that no, don't blame yourself. The congenital heart diseases are multifactorial in origin.
Okay.
So scientifically speaking, it can be genetic or it can be due to some environmental factor. But in general sense, the parents should be knowing what are the things which they can do or they can prevent to decrease the chances of congenital heart diseases.
Right.
And they are all the common practices which we do during pregnancy, like proper antenatal checkups, then taking all the supplements during especially first 3 months of pregnancy, then avoiding alcohol and smoking, avoiding any X-ray exposure.
Okay.
Then if the mother is having any chronic diseases, like mother might be on antidepressants or anticonvulsants, then once she gets pregnant, she should tell the doctor that I'm pregnant. So is there any way we can decrease or change, maybe change the medications?
Okay.
Switch over to medications which do not hamper the development of the child's heart while the child is in mother's womb. So these are the things which can be prevented. Out of other than that, there may be many causes.
This is a major thing, like one has to take care about.
This is the only thing which can be taken care of.
Only thing, and then apart from that, if something happens, then that
is not in our hand.
It's not in everybody's hand, and there is nothing to blame ourselves.
Yes, first thing is we should not blame ourselves. Parents usually they start blaming each other.
Right.
So that should not come into the picture, because whenever we talk about prevention, prevention is primary prevention or secondary prevention and tertiary prevention.
Okay.
Primary prevention is if
during the pregnancy.
No, primary prevention means we don't let the disease to happen.
Okay.
So it is not possible with CHTs. So secondary prevention is, okay, the disease has happened. Now what to do? We have to diagnose it in time. We have to treat it in timely manner, and we have to prevent the complications. We have to prevent it from going into a stage where it is not treatable. So secondary prevention is more important in case of congenital heart diseases.
Okay, secondary prevention.
Yes.
Okay. So during pregnancy also there are a lot of things to take care about because this things has to be known to the parents who are going to be the new mother and father, because these are the things when a baby is born, and things are related to everything. So what things you have just mentioned about the parents which they are blaming themselves. So the psychological part has to be treated properly. Unless and until you are making yourself strong, so the further treatment would not be possible properly, isn't it?
Definitely.
So when you see that when you come around these kind of patients and when you come around to this kind of parents, what is the first thing, doctor, you do? First is the like you have to sit for them and you have to counsel them. Proper counseling is very important. So what are the first things like?
Actually, the counseling of parents with children with congenital heart disease is very difficult.
Okay.
We take around 30 minutes to 45 minutes during first sitting to let them know what is the structure of the heart, what is exactly happening to the child, because congenital heart disease is a broad term. So generally people say that the child has hole in the heart. Hole in the heart is just one form of congenital heart disease.
Okay.
So that's
one form.
That is one form. So if I want to explain it in general terms, our heart is made up of 4 chambers, like 4 rooms.
4 rooms.
They are interconnected with each other. And there are different blood vessels which are going inside and coming out of those chambers. So if 2 chambers have abnormal communication, that is hole in the heart. That is one thing.
Okay.
Then if the blood vessels have some narrowing, or the chamber has some narrowing, it is called as obstructive heart disease. So there will be some obstruction to the blood flow. Then what can happen, these things can occur in combination. Like the child might have a hole in heart along with an obstruction. And the blood vessels, they might be present in some different position. Like the blood vessel A should have arisen from chamber A and B from chamber B, but they are cross connected. So this is also another form of congenital heart disease. So you can see the hole is also different. The hole can be present in the upper part of the heart or lower part of the heart. It makes a whole lot of difference to the prognosis of the child, to the outcome of the child. So whenever there is a hole in the heart, you should not take it generally that people say that the holes in heart usually they close by time and you should give some time and they don't need any treatment. You should not use these general terms because small holes they can fill up by themselves, but larger holes they will not fill up.
So does it happen that it fills up by?
Yes. So if a hole is very small in size, there is about 80% chance that it will close by itself. But we cannot leave it at that.
But we have to have a proper checkup about it. Now, is it small or what is the position of the disease, isn't it?
Yes. So at first diagnosis, we tell the parents whether there is a hole or there is an obstruction or whatever it is. And then we tell them what are the normal chances of spontaneous closure, what are the chances of it not being closed, and what are the chances of it becoming worsened over the period of time. And accordingly, we call them for follow-up. Sometimes after 2 months, and if the hole is very small, maybe after 1 year also. So the main important thing is that the follow-up should be done very authentically. as advised by the doctor. Because many a times we see that a child who was asked to come at 1 year of age, he turns up at 10 years of age, his hole has increased in size and it has become inoperable. So we cannot do anything for the child.
So things has to be done on time, and it has to be like a treatment has to be done on time, so that it doesn't get worse, isn't it? So in general term, like if anyone has to understand about a congenital heart disease, so is it that they can talk about like there is a hole in heart, but there are other ailments also we can relate to it, but it is not only that a heart having a hole is congenital disease. There are a lot of things related to it, isn't it? So causes, so what happens to that patient, like what are the symptoms, what are the causes, like to make out that the person is having some problem?
Actually, as I told, that the hole can be small or large, there can be other obstructive diseases also, the blood vessels may be cross-connected. So depending upon that, the child presents at different age and their symptoms are totally different. So most common presentation is a totally asymptomatic child. They usually go for vaccination at 1.5 month or 2.5 month, the routine vaccination schedule. And the treating general physician, he hears some abnormal sound in the heart. And then he suspects that there might be some heart disease. He refers the child to pediatric cardiologist. Then we do our series of tests and then we come to know about the heart disease. And the second most common presentation is when the parents are very aware. Sometimes the mothers will be able to tell you that the child is not sucking properly, he is not breastfeeding properly, he is very much tired when he breastfeeds, his breathing becomes very fast when he is feeding, and there is some sweating, increased sweating on the forehead while the child is breastfeeding.
So these are some of the symptoms.
These are the symptoms. So when the new babies have these symptoms, the parents should definitely take the child to first point of contact is always a general pediatrician. They have to take them to the general pediatrician. He will check the child, and when suspected, then the role of pediatric cardiologist comes.
So like in what number of age it has been seen mostly? Is it in infants or like after 1 year, 2 year? Like,
so like I said that 25% of the congenital heart disease are critical. So these critical diseases usually present within first 1 month of life. Some present within first 1 week of life. And rest of the 75%, out of them maybe around 40 to 50% they present within first 1 year of life.
First 1 year.
Yeah, and 25% present later. Like around 3 to 4 years of life, the child is asymptomatic, but he is not gaining as much weight as his peers. So that is one of the symptoms. So usually these children have small holes in the heart, which are very
and
much.
Any other activity which is related, like if the child is very active, but he's not able to take any proper food or not having a good appetite. So is there anything related with that as well? Because that's kids, when we see when they are busy playing or something, when they are doing a lot of activity, so they don't feel like having anything. They are only focused with that. Like
poor appetite per se is not a symptom of congenital heart disease, but easy fatigability. Easy fatigability. That is, they get fatigued very easily.
Very tired.
Yeah, like a 2 to 3 year old child, he should not be able to sit calmly. He should be running around. So if a 2 to 3 years old child is sitting and you are thinking that he's very calm and good child, then no, you should think that there might be some problem also. So you should get him checked.
And always a health checkup is very important, and if we talk about children, so health checkups are more important for children. So it's always good to have a regular checkups of their children. Apart from the vaccination, when they go for the vaccination, of course there is the pediatrician and he will have a proper checkup for the children. But apart from that, if you find anything like unusual happening with your children, you don't find like it's better to be sad or confused, it's better to take them to the pediatrician to get things clear, isn't it? Now let's talk about some of the suggestions, like how are the things prevented, and if any patient or any children comes with these kind of problems, so what is the first thing a hospital or what is the first thing a pediatric cardiologist do, doctor?
See, first we have to diagnose properly what is the problem.
As you mentioned that like for the vaccination he went and then
murmur.
There was a murmur or a sound kind of thing and it has been referred to a pediatric cardiologist. So then what happens?
So 95 to 99% of cases we can diagnose by echocardiography. It is like an ultrasound of heart. So it is a very simple procedure. It is done in OPD basis, and usually we don't have to even make the child sleep for this procedure. While the mother is holding the child, we can do it, and it can diagnose 99% of the problems. So once we diagnose the problem, our first duty is to explain the parents about the condition, what is all happening inside the child's heart. Then we tell them about what is going to happen. Will it resolve spontaneously or will it need some treatment? What are the chances? Then the child might need some medications also. Then we start the child on some medication and we ask them to come after maybe 15 days or 1 month. And once they come for follow-up, then we assess whether the medications have worked or not in decreasing his symptoms. The medications, one thing I want to make clear, that medications are not to close the hole in the heart. The medications are to decrease his symptoms.
Decrease the symptom, find out the what is the symptom and what is the strength of the disease, so that it can be treated more properly.
Like the child was not able to feed properly. His breathing was becoming very fast during feeding. So we give medication so that he can now breathe normally, he can feed normally, so that he can gain weight. And over a period of time, we assess whether the hole is increasing in size or it is same, and then we decide what time the surgery has to be done.
So this medication is given to each and every person, is it depending on the disease, depending on the case?
Symptoms.
Depending on the symptoms and the case.
So universally, you cannot prescribe all the medications to all the children with CHDs. These are case specific.
Case specific.
Yes, case specific. So different medications for different cases, and some children may need only follow-up, no medications at all.
So after the medication is given and there is a certain period of time, like you have been asked the parents to come and see you again. So that has to be followed very strictly. Whichever time or whatever doses have been given, that has to be followed, and each and every time. And then after that, when they visit you, so after that what happens?
So if we see that these cases, they are going to need definite treatment. So we have different modalities of treatments. Earlier, the only treatment for congenital heart disease was surgery, open heart surgery. But nowadays, around 50 to 60% of the congenital heart diseases, they can treat it with transcatheter devices. Like if there is a hole in the heart, we can go through a vein in the child's leg, and we can pass an umbrella-shaped device inside the hole. And once inside the body, we inflate that umbrella, so that umbrella closes the hole.
So without the open heart surgery?
Without open heart surgery, around 60% of the diseases can be cured, especially small and moderate sized holes. The obstructive lesions, which I told, narrowing of blood vessels, we can use balloons to open up the blood vessels, or we can put some stents to keep those blood vessels open. And other than that, for congenital cyanotic heart disease, like there are some diseases where the child becomes bluish. When either at rest or especially when he is crying. So there is mixing of blood, mixing of oxygenated and deoxygenated blood. These diseases and the complex heart diseases, they need surgical treatment. Definitely. They cannot be closed by transcatheter procedures. So these are two types of
everything depends actually about the case, like how the case is, so the medication has been given, and after that, like if not medications, then what is the procedure of the treatment, that will depend on the particular case, isn't it? Symptoms are very important. That's why, like, if any parents find anything unusual among their children, so they should immediately contact any pediatric, so that they can get to know that what exactly is happening with the children, isn't it? So what are the different types of congenital disease, like heart diseases, doctor? As you have mentioned about this one hole
in the heart, then obstruction in the blood vessels.
So which is more seen? Which is more seen in children?
The hole in the heart is most common. That's why in general terms everyone says that the heart disease in children means hole in the heart.
Hole in the heart.
Because it is the most common one. Around 60% of the congenital heart diseases are holes in the heart. So rest of them are obstruction in any blood vessel. It may be your aorta, the blood vessel supplying the body, or it can be in the pulmonary artery, that is the blood vessel supplying the lungs. So narrowing, then cross connection of the arteries, it usually presents in newborn period within first 7 to 10 days of life. So and cyanotic congenital heart disease in which the child becomes blue. It is usually treated within first 1 year of life.
First 1 year. And the one you mentioned that it might like close itself, and that close itself one is, so how long does it take? Like,
see, if I have to take names, then atrial septal defect
Okay.
If it is less than 8 millimeter in size, we have some parameters, then it has high chances of closure, around 90%, 80 to 90% of them will close. But even then, we call the child after 1 year to make sure that the hole is closed. And the other are ventricular septal defects. It depends upon their size. The large ones are not going to close.
Okay.
Even during first visit, if we see that the hole is very large, the chances of spontaneous closure is only around 15 to 20%. So we actually prepare the parents mentally during the first visit itself for these cases, that they should be prepared for surgery within next 2 to 3 months, maybe by 6 months of life, because they have to be psychologically prepared for that.
Have to be psychologically prepared actually.
Yeah. And they also need family support for that. So
psychological preparation is very important. Like whenever any parents come to you, so there will be a lot of questions in their mind, and maybe they will get a lot of suggestions from in and around themselves as well, that why such like things happen with a little kind of like infant. So why is it happening? So there are a lot of things which any neighbor or any parents or any like your friends and family will not be able to tell you apart from your doctors.
Actually, you should not ask your neighbors or family members about this.
You'll get a lot of information, but not the correct ones.
You'll get a lot of misinformation. And for that, actually, we have some support groups also. In India, this concept of support groups is coming up. Like whenever I get a patient, suppose I get a patient with large VSD and the parents are very apprehensive, what will happen? So I usually give them contact number of 2 or 3 patients whose children had large VSDs and who have got operated and who are doing well. So
they might get an idea, and they might get a counseling from them. The ones who have already gone through the entire phase, so they might give them a clear picture about everything. So that is the best part, like, and it's very difficult for the doctors to make them mentally prepare that your child might go through like operations or go through any kind of surgery, so you have to be prepared, because that kid is not able to understand anything. So for him or for her, it is very difficult to make like their parents understand what he is going through it. And maybe there might be a lot of symptoms which is not being able to understand by the parents itself. So as you said that when it is when we talk about that 1 month infant, so there are a lot of things like unless and until when you visit a doctor, there are a lot of things you don't come to know. But apart from that, there are a lot of like parents who come to know about certain kind of like unusual things, and then they can consult a doctor. Or like if we talk about the treatment part, doctor, you already mentioned about the treatment part. It's nowadays not only necessary for the open heart, but it can be done through the vessel, any kind of like medicines and vessels as well. So if we talk about like the precautions which these parents will have to take after the treatment when they go back to home, so what are those? In all sides, like not only like but in part of like a sleeping or while dietary part or everything, like what would be that?
See, it is nothing different from any other child, because all the children are in growing phase, and it is not any different for the child who has had congenital heart disease. So definitely the diet should be proper, no junk foods, definitely. But we cannot put 100% restriction on children, as we know, because it is very difficult to restrict them totally. And the second thing is, most of the diseases after surgery, they get 100% cured. But some of the conditions, they may need reoperation also. Parents should be aware of that also. Around 10 to 15% of diseases, they may need reoperation at a later stage.
Why is it so?
Like because they are complex diseases. There is not only a single hole in the heart or obstruction. The obstruction may be at various levels. There may be multiple holes, and
so is that not found initially, or that might be like a
that is not
later?
Technically possible to
find everything.
Suppose you have 2 holes. One hole is in the center of the wall, the other hole is at the corner of the wall. So for surgeon, surgically, it is possible to close the central big hole, but he might not be able to close the hole which was at the corner. So when the child becomes bigger, his heart also becomes bigger. So technically the operation becomes easier. But we cannot wait for a later age for the first operation. The first operation has to be done at a certain age.
So things go back to back, and things go on their time. And,
but not for all cases.
Not for all cases.
Majority, 60 to 70% cases, they will require only one procedure. Rest 20 to 30%, they might require a reoperation, or they might require some medications later in life. And might be some congenital heart diseases whose prognosis might not be very good.
Okay.
Even after surgery, the child may not be able to lead a complete normal life.
Okay.
Yeah.
So what would be the message for the parents, doctor, like whoever is getting diagnosed or suspected? So what message do you want to give to them?
So first of all, I would like to say to the parents that you have to be very aware and attentive about all the symptoms of your children. Whenever you feel any suspicion, you just talk to your general pediatrician and show him your concern. And if he advises you to go to a pediatric cardiologist, please do so. And after the diagnosis is made, then first and foremost, you talk to your pediatric cardiologist openly. Try to understand each and every aspect of the disease before leaving the OPD during the first visit itself.
Okay.
Because once you understand the disease properly, only then you will be able to take care of the child.
Absolutely.
Then thirdly, you should know about all the medications, how frequently you have to give them, how frequently you have to come for follow-up, and you should be psychologically prepared for any surgery or any procedure which might happen in the future. And first and foremost, don't panic.
Don't panic and take extra care of themselves as well, because if you take care of yourself, then only you can take care of your children.
And one more thing I would like to tell, when the parents have first child as congenital heart disease, when they become pregnant for the second time, then they can take some precautions, like they can tell their obstetrician that their first child was suffering from congenital heart disease. Then he can advise them to go for a fetal echo.
Okay.
So fetal echo is the same echocardiography. It is done on an unborn child while he is still in mother's womb, when the mother is around 18 to 20 weeks pregnant, so that the congenital heart disease can be diagnosed even before birth.
Okay, so those are some of the things like we need to know about it. And thank you so much, Dr. Supriya. We are just really short of time, so we have to wrap up this show. So I'm sure viewers, you have watched this show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.